Hello everybody and welcome to Laboratory M6 where we will be covering the leg muscles.
We have your anterior leg compartment and we have 4 muscles here. But before we do that, I just want to review real quick the actions of these muscles. So first we have inversion of the foot. So you're taking that medial portion of your foot and moving that upward, whereas eversion is the opposite. You take the lateral side of your foot and move that upward. Dorsiflexion and plantar flexion, we are going to have in dorsiflexion your toes pointed upward, whereas plantar flexion your toes are pointed downward, kind of like a ballerina. Now I also want to give you some tips on memorizing some of these actions. So anytime you see the word tibialis in a muscle's name, it is going to invert the foot. Anytime you see fibularis in the name, it's going to evert the foot. And all muscles that course anterior to a malleoli, doesn't matter whether it's your medial or lateral, it is going to dorsiflex the foot. So I'll kind of mention that throughout these next slides. And all muscles that insert into the calcaneus will plantar flex the foot. So I also want to give you a tip as far as memorizing innervation of the leg. We're going to have muscles that are innervated by the superficial fibular nerve and the deep fibular nerve. So superficial people that stand with their leg out laterally are going to demonstrate that the lateral compartment of the leg is innervated by the superficial fibular nerve. Whereas people who are deep thinkers and stand with their leg facing anterior are going to help you memorize that the anterior compartment is innervated by the deep fibular nerve. So first we have your tibialis anterior, and its placement makes sense. It's anterior to the tibia. So it's going to originate on the upper lateral tibia and insert itself onto the medial cuneiform and the first metatarsal. Its action will be to invert and dorsiflex the foot. So we have that word tibialis in the name, so we know that it's going to invert. And then you could see in this image, it is located anterior to this medial malleolus, so it too is going to dorsiflex the foot. And its innervation, because we're in our anterior compartment of the leg, will be deep fibular nerve. Next we have your extensor hallucis longus, and remember when you have the word hallucis in there, it's always going to refer to the big toe. So this muscle originates from the middle fibula, so you can also keep in mind if you're trying to memorize some origins that hallucis originates, any muscle that has the word hallucis in it originates from the middle fibula. And the insertion is the distal phalanx of toe 1, and its action is to extend the big toe. Innervation is deep fibular nerve. I'm going to go back a step here. So next we have your extensor digitorum longus. This is going to originate not only from your lateral condyle of your tibia, but also the upper fibula. Then it'll go and insert into toes 2 through 5, and just based on its name, we're going to know that it's going to extend toes 2 through 5. And we're in our anterior leg compartment, so we know innervation will be deep fibular nerve. Next we have your fibularis or PERONEUS tertius. So you're going to see that a lot of these muscles or nerves have dual names, either fibular or peroneal or fibularis or PERONEUS. PERONEUS is the older term and fibularis is the newer term. So we're in this phase of transferring over to use the term fibularis more, but some of the old timers that are still in practice will use the term PERONEUS. So just keep that in mind. So I'm showing you a lateral view here because this is the lateral most part of your anterior compartment. This muscle originates from your lower fibula and inserts into your 5th metatarsal. There is a certain population that is missing this muscle. I just am not sure what that percentage is, but I'll look into it for you guys in case you're interested. And its action will be to evert and dorsiflex the foot. That makes sense because the word fibularis is in this muscle's name, so we know eversion will take place. And then if you look at this muscle, it is anterior to your lateral malleolus, so it is going to dorsiflex the foot. And its innervation is the deep fibular nerve. So I just wanted to show you when you're looking at this on a cadaver, what you want to do is count your tendons of your digitorum muscles. So 1, 2, 3, 4, and then that fifth tendon is going to belong to that fibularis tertius muscle. Next, we have your lateral leg compartment, and we only have two muscles here. They're both going to evert the foot because the word fibularis is in there, and then they're going to be innervated by the superficial peroneal or superficial fibular nerve. So let's move into your fibularis longus muscle. This is originating from your upper fibula, and it's really interesting because what this muscle does is it wraps its tendon underneath the foot to go over to the medial side and insert itself onto the medial cuneiform and first metatarsal. Its action is evert the foot, and innervation is superficial fibular nerve. Next, we have your fibularis peroneus brevis muscle. So you're going to find that deep to your fibularis longus muscle. So this will originate from the lower fibula because it's shorter than the longest, right? And it inserts itself onto the fifth metatarsal. It too is going to evert the foot, and its innervation is superficial fibular nerve. So I just wanted to show you these muscles in comparison. On the left, we have fibularis longus. On the right, fibularis brevis. And you could kind of see that tendon in your fibularis longus going underneath the foot here, so it's a little faded, going over to that medial cuneiform and first metatarsal. So next we have your posterior leg compartment. We're going to start with the superficial posterior leg compartment. And these three muscles are all going to have the same action, which is plantar flexion of the foot, and that is because they're all inserting into the calcaneus. And all posterior leg muscles will be innervated by the tibial nerve, whether it's in the superficial or the deep compartment. So first we have gastrocnemius, and I mentioned this in class. Remember that this word, if you break it down, gastro means stomach, and cnemius refers to the leg. So this is a bellied muscle of the leg. So we have two bellies here, medial and lateral. So these bellies originate from the medial and lateral condyles of the femur and will go down and insert into the calcaneus bone. Its action is plantar flexion of the foot, and innervation is tibial nerve. Now when you peel that muscle away, you will see the soleus muscle. And the soleus muscle was named after the solefish. So it's just a very flat fish. So this is going to originate from the upper fibula and upper tibia. And so I always like to think of the soleus as being a fly fish. I don't really know what kind of fish the solefish is, but I doubt it's a fly fish. So that's why I think up and up. This fish is just jumping up onto the fibula and up onto the tibia. Insertion is calcaneus once again, action plantar flexion of the foot, and innervation is tibial nerve. Now sitting in between, so I'm going to pull this shading away, sitting in between your soleus and your gastrocnemius here is this very thin tendon. So let's look at this on the next slide. That thin tendon belongs to a muscle called plantaris, and this originates above the lateral condyle of the femur, inserts into the calcaneus, and will plantar flex the foot and have innervation of the tibial nerve. Now this muscle was nicknamed the freshman's nerve because mean anatomy professors would put a pin in the tendon of plantaris and ask, "What nerve is this?" to the medical freshman students. And so the enlightened ones would know, hey, that's not a nerve, that's the tendon of plantaris, and would put down that as its answer. So the top portion of this muscle, the 1/5 of this muscle, is the actual muscle belly, and the rest of it, the 4/5, is tendon. So next we have the deep posterior leg compartment, and only 3 muscles here, and all of their innervation will be tibial nerve because we know tibial nerve innervates the posterior leg compartment. So we've also nicknamed these muscles as Tom, Dick, and Harry. So tibialis posterior is Tom, flexor digitorum longus is Dick, and flexor hallucis longus is Harry. And we put the word "and" in there because there's an artery and nerve that sits between Dick and Harry. So I'm going to show you why we use that mnemonic. So if we are moving posteriorly from this medial malleolus, you can go and see these tendons of these muscles sitting in order. So this would be tibialis posterior, or TOM. This one would be your flexor digitorum longus, so Dick. There's Ann, your posterior tibial artery, and your tibial nerve. And then you have your flexor hallucis longus, which would be Harry. So here's what it'll look like in a cadaver. The artery and the nerve has been removed here, but you could see tibialis posterior right behind the medial malleolus, your flexor digitorum longus, and then lastly your flexor hallucis longus. So this is a little bit blurry of an image, but if we were to completely dissect all the superficial posterior muscles away, you're going to be able to see that TOM, or tibialis posterior, is actually in the middle, even though its tendon is the first one behind that medial malleolus. So don't let that confuse you. And I made up a little personal ad for Tom here, and his last name is Tarsals, and he likes to go fishing. The reason I say he likes to go fishing is because his origin is from the same place that soleus was, the upper tibia and upper fibula. And its insertion is the tarsals, hence his last name, and he's 24 years old, so it's also going to insert into metatarsals 2 through 4. Its action, we're going to know from its name, it has tibialis in there, so it's going to invert the foot, and innervation is tibial nerve. Okay, so this is kind of how it all lines up. All right, now we have your flexor digitorum longus, aka Dick, and he's going to be this first one over on the medial side here. It's going to originate from the middle tibia, insert into distal phalanx toes 2 through 5, and based on its name, we're going to know it's going to flex toes 2 through 5, and it's innervated by the tibial nerve. So here is tibialis posterior, or TOM. We talked about flexor digitorum longus, Dick. And then remember we had Ann, so posterior tibial artery and the tibial nerve. And lastly, we're going to talk about flexor hallucis longus, or Harry. So this is Harry over here. He's going to be the deepest one over on the lateral side. And he originates from the middle fibula, because we said all hallucis muscles will originate from the middle fibula. It will insert into distal phalanx of toe 1, and from its name we know it's going to flex toe 1, and its innervation is the tibial nerve.